We're at Concept Cosmetic Medicine and we're talking to Dr. Rachel today about what I want to call the perfect pout. Because we do a lot of that these days, the selfies, we all tend to do a little but we might see a lot of lines and wrinkles and may not have the volume as we age as well. So thank you for chatting with us.
Thank you, Roz.
Is there a term that we can call this area that might be looking a little bit gone, a little bit old and worn?
Well, the PC way of saying it is the barcode lines.
Right.
But I did once have a patient who referred to her mouth as resembling the southern end of a northbound cat, which I actually thought was quite funny at the time. But if you think about it, it's a little bit poignant.
Yeah.
And no one really wants a cat's mom.
No one wants that look at all. Now, this is what happens, right? As we age, we tend to lose volume everywhere, but particularly the mouth area. And a lot of us might have been smokers, may spend a lot of time talking. So those lines around the mouth area, say the downturn through here, those lines up at the top there, there's kind of a point where you go that they're not going away. Your lipstick might feather into it.
The bleeding lines.
Yeah, you're not getting the same kind of pout that you once did. So
Yes.
what are the sorts of things that we can do about it?
Well, it is interesting that you talk about that aging area because it starts quite young. And if you think about the parts of the body that comprise fullness to that mouth, you've got bone, muscle, fat, and skin. And all of those go like this and diminish.
Right.
So if you combine that with talking, smoking, sun, you're going to get the beginnings of lines that I reckon probably happen to girls. Interestingly, not boys.
Oh,
They don't
that's
get
not
it.
fair.
It is not fair. They seem to have this protective effect through here because of hair. So
Okay.
girls probably start to develop these lines, I reckon, in their 40s. And that would be the common age I get, 40s, 50s and 60s of people doing this treatment.
All right, so if we've established we've got a few of those barcode lines and we want to do something about it, what is it that you can do to make that a better look on our face?
Okay, well what I try to do is I try to think about what area has lost its volume and try to restore that part. So of course I can't be restoring muscle and bone, it's more about that fat layer and then the skin itself. So if we think about essentially two reasons that this will occur, loss of volume coupled with overactive muscles around the mouth. So what I'm trying to do, I call it the triple treatment. And I'm doing three things. So the first thing I do, actually I'm going to say four things.
Okay.
Because the first thing I do is numb people. Because I think that's a big worry that
Good
people
key.
have, is it's going to hurt. But it doesn't, it's not that bad at all.
Yeah.
So numbing is a big part of what I do first. And the three stages of what I actually do for treatment are a tiny, tiny drop of dermal filler put into the deeper, more etched out lines so that they look smooth.
Okay.
The second thing is I put some stuff that I call injectable moisturiser, and that gets put as a blanket all the way through that top lip for more smoothing. And then the third thing is a little drop of anti-wrinkle injection to try and cover and stop that pulling of the mouth. So then you're trying to fix those two things, the volume and the overactive muscles.
So you're really balancing out that whole upper layer, not just one thing, as you say.
Yeah,
there's-
not just a line.
Yeah.
It's about restoring the whole area and making it look so that the person can walk in and walk out and not look silly.
Yeah.
Because that's the biggest worry. People go, I'm not going to do that
Yeah.
because I'm going to look.
I don't want to have the trout pout.
The
going
trap
on.
pout, the
Yes.
dreaded trap pout. And you see them.
Yes.
There's an army of Instagram lips out there.
Yes.
And
But if you
It's not
want
gonna- yeah.
natural results that obviously people don't necessarily notice, but somehow you look better, then that's a key.
Yeah.
Now you touched on pain. I think that is a fear for a lot of people. So what can we expect? What's the process there?
okay, so you're talking about after the treatment is done, what can people expect?
Yeah, both. If you walk in, you said you do a numbing cream.
Yeah.
If no one's ever had that before, what does it kind of feel like? What are we to expect?
So the numbing cream is simply just a paste that goes on,
Right.
and it makes your lip feel a bit sort of cold and numb.
Okay.
We will often couple that with a little bit of inhaled analgesia, which is fun.
Yes, and you're
And-
able to do that because you're doctors.
Yes, we're
here.
all doctors
That's
at
right.
Concept. And then the treatment is done. It's truly meant to be walk in, walk out. So it's not a big thing, it's like a half-hour thing, and then people can go back to their life. Afterwards, in the few days afterwards, people might experience a little bit of swelling or let's call it puffiness. If you're unlucky, you can get a bit of a bruise, but I actually say put a bit of makeup on there, and sorry dentist, but I blame the dentist. And the other thing is to talk about is because I'm putting that tiny bit of the anti-wrinkle injection in, and as we all might know, that stops muscles with their strength. So there are a few things that your mouth feels a bit funny doing
For the first
for
little
the
while.
first little while, but it's just transient.
Yes.
And I tell everyone, I got a good list. There's not that many, but
No, it's not. And I know that it is something that you can, of course, get used to as well. How long does it
Yes.
last for, do you think, the overall process? Or do we need to top up?
that is a good question. So I reckon that I see this done in people probably about twice a year.
Okay, that's pretty good. Yeah. So we're getting all of those things done in one sitting, one lot of numbing cream, walking out, and maybe a little bit of downtime, but more so just the effects will be there for a good 6 months maybe.
Yep, that's exactly right.
Terrific.
But the ultimate aim of what I'm trying to do is to make the lip look smoother. It's not about being bigger. It's just about being smoother.
Thank you, Dr. Rachel, for telling us all about the lip area. If you would like some more information, or if you'd like to book a consultation, of course, with Dr. Rachel, you can do so conceptcosmeticmedicine.com.au.